To start? Yes, and we'll start with Mr. Lucas. I understand that you have a presentation that you're going to forward to us later.
I will. Thank you very much. I'll be speaking to it today, so the notes will come to you shortly thereafter. I'm here representing the Canadian Medical Cannabis Council today. I also want to share that I'm a research affiliate with the Centre for Addictions Research of British Columbia and Vice President of Patient Research and Access at Tilray, one of the licensed producers here in Canada located in Nanaimo, BC. I've been working personally on medical cannabis for about 22 years now, so this is an area that's somewhat familiar to me, and it's a pleasure to be here to be able to share some of the work and knowledge and research that we're doing with you here today. I want to tell you a little bit about the Canadian Medical Cannabis Council. We're an industry association representing 7 licensed producers and approximately serving about 40,000 patients from that group of 7 licensed producers. And one of the distinguishing characteristics of the Canadian Medical Cannabis Council is putting a patient-centered lens on our policies and practices. And to that effect, we have a patient advisory committee made up of national organizations that include the Arthritis Society of Canada, the Canadian AIDS Society, Canadian Cancer Survivors Network, the GI Society of Canada, a number of other organizations that help advise us when it comes to the policies and that we put forward and our lobbying positions as well. Some of the CMCC priorities include lowering the costs of medical cannabis and improving access to patients. And to that extent, we've been urging the federal and provincial governments to maintain a clear separation between medical and recreational cannabis markets through differential taxation. And what I mean by that is we feel that medical cannabis should be treated like all other prescription drugs in Canada and not be taxed. And certainly that's one of the things I hope to be able to discuss with you guys as we take questions today as to why medical cannabis should be zero-rated like other medications in Canada. I'd also like to share that we're working with private insurers to help improve and increase the insurance coverage for medical cannabis patients as a precursor to getting provincial coverage for patients in Canada. Today I'm going to share some results from a national patient survey that we conducted in January. It's the largest patient survey ever conducted in Canada with 2,032 responses, and I think it'll help illustrate some of the ways that end users are using medical cannabis in Canada, because there's a lot of overlap between the patient population and the recreational cannabis population as well. So the average age of this particular population was 40 years old. So we actually see that it's actually middle-aged individuals typically who are seeking medical cannabis. A lot of the time they've had treatment failures and they're seeking alternatives to their current prescription drug use. In terms of primary conditions, we find that mental health, which is a grouping of insomnia, mental health, and post-traumatic stress disorder, is actually the #1 reason why patients are using medical cannabis. That covers 40% of all patients in Canada. And that's closely followed by pain, which is a grouping of arthritis, chronic pain, and headache, which represents about 37.5%. So what you see is about 80% of patients in Canada are currently using cannabis as a treatment for pain or for mental health. In terms of average use, we see that patients report using on average about 1.5 grams per day, and that 78% of patients actually use 3 grams or less per day. So you're not seeing large patterns of use here. That data is consistent with research that's been done in Canada and the US, as well as in Europe over the last few years. It shows that most medical cannabis patients use between 0.5 and 1.5 grams per day. In terms of primary method of use, I have good news to share because I've been doing this kind of research for the last 10 or 15 years. And in this survey, we find the primary method of use reported is vaporization at 31%. It actually beats out joints and pipes and water bongs that might have been more popular in the past. So this is a really health-conscious shift that we're seeing from a medical cannabis population. But I also think it has policy implications as we move to regulate even the vaporization of products in Ontario and throughout Canada. The kind of key focus area of my research is cannabis substitution effect, which is the way that patients as well as recreational users consciously and subconsciously use cannabis instead of using other substances. So I'll share a bit of data on that from this survey today. We do find that out of this survey, which once again is by far the largest survey of Canadian cannabis users to date, 69% of patients report substituting for prescription drugs. So they're using cannabis in order to reduce their dependence on prescription drugs. But we also find ad hoc substitution for alcohol by 44%, substitution for tobacco by 31%, and substitution of illicit substances by 26% of the population that had previously used these substances. Now, I like to get a bit more granular with my data, and so when patients say they substitute for prescription drugs, I ask them, well, can you name 3 prescription drugs you're substituting for, or up to 3? And it should be no surprise, knowing that patients are using cannabis for pain and mental health, that 35% of the substitution is for prescription opioids. Now, that's closely followed by antidepressants at 21%, and then non-opioid pain medications at 10%. We also see very high rates of substitution for benzodiazepines, which are nearly as problematic in our society as opioids are in terms of dependence and public health impacts. I wanted to get even more granular than that, so when patients cite that they substitute for opioids, I ask them, are you substituting at 25%, 50%, 75%, or are you giving up opioids altogether? And what we found is of the 458 patients that cite substitution for 610 total opioids, understanding some patients use more than one type of opioid, a full 60% were given up altogether at 100%, and a further 18% were self-reported to be given up by 75% or more. In terms of alcohol, we get similar data. 513 respondents who substituted for alcohol, 31% of those say they gave up alcohol altogether, just as a kind of ad hoc effect of introducing medical cannabis into their course of care. Now, I want to use that as a segue to look at some of the research that we've seen come out of the U.S., both in terms of medical cannabis states and the recreational cannabis states, because I think it can help inform what we can expect here in Canada. Over the past 20 years, over 20 states, as you know, have legalized access to medical cannabis, and right now 8 states have also legalized recreational adult use of cannabis. Now, this has led to significant impacts on public health and safety. That includes a reduction in opioid overdose deaths, and in fact, there's a study published in the Journal of American Medical Association that showed a 25% reduction in opioid overdose deaths in medical cannabis states compared to the neighboring states. And the longer the medical marijuana program was in place in the state, the greater the effect. We also see reductions in alcohol-related automobile fatalities, reductions in violent crime and homicide, reductions in suicides. And I heard this answers one of the questions we heard today. We also see a decline in teen use of cannabis. And in fact, there was a report that came out for a national survey just last week that reported that teen use of cannabis has now declined to a rate, it hasn't been lower since 2002. So we're seeing a significant decline in the teen use of cannabis. We are seeing a slight increase in the use of adult use of cannabis, but interestingly enough, it's also accompanied by a subsequent decrease in the use of alcohol and associated harms. Now, all of the harms that I've mentioned that are reducing right now, whether it be violent crime, homicides, suicides, or otherwise, the researchers suggest are being reduced because of that substitution of cannabis for alcohol. Now, other impacts include that great impacts on taxation. Colorado now makes more money on the sale and taxation of cannabis than they do on alcohol. This in the home of Coors. And also on job creation. In 2015, Colorado created 18,000 jobs and generated $2.4 billion in economic activity through their cannabis policies. That leads me to a discussion that I think is important for this committee to consider, which is the importance of brands when it comes to defeating the black market. We've heard today in previous speakers talk about the fact that right now, if you go online, you can order cannabis from 20-plus different sources online across Canada. None of those are legitimate sources of cannabis, and it'll be incredibly important to allow Canadian consumers to differentiate between the illicit market and the new and emerging illicit market. And one of the ways that they can do that is through the importance of brands. So the rationale for responsible branding directed to adults includes eliminating the confusion between the illegal and legal markets, to allow professional companies to separate themselves from less scrupulous competitors, to differentiate high-quality products from low-quality products, and to provide an opportunity to educate consumers about responsible consumption. Now, this is started an initiative that's taking place right now between a number of the licensed producers in Canada. In fact, 16 licensed producers representing 90% of the medical market right now, and both industry associations, Cannabis Canada as well as the Canadian Medical Cannabis Council. This is an initiative that we're doing with Advertising Standards Canada to develop a self-regulatory regime to allow responsible branding to adults when it comes to the recreational access to cannabis. Now, the principles of this initiative are that marketing by licensed producers will only promote brand preference, will not attempt to influence adult non-consumers. The marketing by licensed producers will not be directed to persons under the age of 18 or whatever the limit is at the individual provinces, be it 19 or higher in individual provinces. That all advertising messages will contain responsible use statements, which goes much further than what we see from the current alcohol industry. That licensed producers may voluntarily obtain pre-clearance of advertising campaigns in order to ensure they meet these guidelines, and that licensed producers agree to adhere to provisions of the Canadian Code of Advertising Standards. So in conclusion, I'd like to say that medical cannabis, as I've reported, is primarily being used in the treatment of chronic pain and mental health. The medical cannabis patients commonly self-report substitution of pharmaceutical opioids, of alcohol, often leading to complete abstinence of the substances identified. And the branding can not only reduce the harms associated with legalization and regulation of adult use of cannabis, but can also maximize the potential public health and safety benefits. Thank you very much for your time today. I really appreciate it.
And thank you for your information. The report that you're going to submit will be available when?
We're going to be submitting it by the end of the day,
okay.
And I think we're going to make use of your translation services here to be able to translate some of that. We're also going to be submitting a brand new publication from a study that I've done called Rationale for Cannabis-Based Interventions in the Opioid Overdose Crisis. I'm happy to speak to that today if there are any questions regarding the use of cannabis and opioids, and another study as well that I've done on substitution of opioids as well. Thank you very much.